When she was 18, Nicole Riley noticed a pink pimple on her hairline. She expected it to go away on its own, but over time, the bump kept getting bigger and bigger until it was almost the size of a pencil eraser. When she had finally decided to go see a dermatologist, her biopsy results discovered she was suffering from stage 3 melanoma. But Nicole's story isn't the only one. In 2021, an estimated 100,350 adults in the United States will be diagnosed with invasive melanoma of the skin. Since melanoma causes most skin cancer deaths, it is important to detect and diagnose the cancer at an early stage for effective treatment and care. Hi, my name is Leanne Ho, and I'm joined by Vikram Chatterjee, Timmy Bowie, and Beeper Shrestha from NOCROP at Oxford Academy. Today, we'll be introducing our innovation, the Melapatch, as a bridging step towards efficient melanoma diagnosis. To begin with, what is melanoma? Melanoma is the most dangerous type of skin cancer, and it can develop on any area of the skin. The primary risk factor in developing melanoma is exposure to ultraviolet radiation from sources such as sunlight and artificial tanning beds. UV radiation damages the DNA within the genes of the skin cells, eventually growing out of control when exposure is constant. Without the use of surgical procedures, current technology fails to identify melanoma in a convenient and clear way. A common at-home visual test for melanoma is the ABCDE method. Individuals will look for asymmetry, uneven borders, a dark black or multiple colors, a diameter larger than 6 millimeters, and an evolving and changing mole. Although this test can give signs of melanoma, many of these test factors are subjective. With the Melapatches, individuals can confirm the presence of melanoma through an objective chemical test to ensure more accurate results at home.
Currently, a professional melanoma diagnosis starts with a visual examination of a suspicious mole or spot on the skin. Typically, doctors can remove the growth for examination and inspect the sample for cancerous cells in an excisional biopsy. Also, imaging procedures like CT scans, MRI, PET scans, or X-rays can be used to deter cancer cells throughout the body. However, these current methods are costly. Biopsies can range between $120 to $450, with lab evaluation fees adding an extra $50 to $350. Similarly, CT scans range from $270 to upwards of $5,000. Although effective, these methods can be difficult to afford for those who are uninsured or struggling financially. Our innovation, the Melapatch, provides a less invasive and more affordable method of detecting melanoma cancer cells without involving surgical procedures or imaging tests. Melapatch functions as a skin patch that detects melanoma cells through a series of chemical reactions resulting in color changes. In traditional procedures, numerous immunohistochemical stains have been employed to detect metastatic melanoma in sentinel lymph node biopsies. T311, an antibody into the tyrosinase recombinant protein, is often used as one of these diagnostic immunohistochemical reagents for use on pathologic materials such as melanoma. Metastatic malignant melanomas are immunoreactive with T311 and show a homogeneous expressive pattern. In addition, HMB45 is an immunohistochemical stain that enhances the indication of metastatic melanoma by detecting the monoclonal antibodies contained by premelanosomes. For this reason, our Melapatch contains both T311 antibodies and HMB45 stains that will react with the malignant melanoma on the epidermis of the skin. If there is immunoreactive activity, the patch will have a stained orange-colored pattern. Only one stain may not be a reliable marker for the detection of metastasis from melanoma. Thus, using two immunohistochemical stains in conjunction with each other decreases the likelihood of errors in our detection.
To assemble our product, Melapatches require gauze and stretch fabric for the physical component and samples of the HMB45 stain and T311 antibody for the chemical component. For a product box of two 6-square-inch Melapatches containing 0.01 milliliters each of HMB45 and T311, the cost of production is $27.14. How relevant is this medical innovation? It is both significant and timely. This product has the potential to positively impact the future of healthcare, increase the quality of life, and reduce healthcare costs. Currently, individuals with melanoma may be uninformed on the self-diagnostic process and identification of malignant regions on the epidermis, and they may fail to receive treatment for such a threatening form of skin cancer by the time the cancer cells spread throughout the body. In such cases, the Melapatches allow for quick and cheap self-diagnosis that can be applied to any suspect area of the epidermis. Melapatches can be used as preliminary screening before arranging an appointment with a doctor before they use formal tests like biopsies to confirm the diagnosis. But healthcare can be expensive for those who lack the financial resources for treatment. Patients with Melapatches will have a clear understanding of whether their condition calls for professional care. The self-diagnostic aspect of Melapatches reduces unnecessary trips to the doctor, relieving patient anxiety at home and allowing doctors to prioritize actual high-risk patients. Our goal is that consumers are able to use these patches independently with little training beforehand. Firstly, they need to make sure the skin area being tested is clean and dry. Similar to a sticker, the consumer peels off the paper to reveal the patch's adhesive. Following the instructions and diagrams on the packaging, they press their fingers along the edges of the patch. They leave the patch to react with the skin for 1 minute, then simply peel the adhesive off the skin to remove it. Observing a visible orange color change on the inside of the patch allows the consumer to confirm the presence or absence of melanoma cells. Finally, they will dispose of the patch and rinse their skin with soap and water to remove any residue.
Similar to an adhesive bandage, the Melapatch is shaped in the form of a rounded rectangle, about 2 inches in width and 3 inches in length. However, with a more detailed look, the patch has 2 layers, the adhesive layer and the reactive layer. The adhesive layer is created using stretch fabric and encompasses the entire patch, with each end containing acrylate that adheres to the skin. This maintains enough contact with the epidermis to initiate a reaction while also having the ability to remove safely. The reactive layer is a soft, thicker section made using gauze on the underside, which contains the antibodies from the 2 immunohistochemical reagents. These reagents react with the malignant region to facilitate a color change within the gauze itself. The entire bottom surface is protected by a thin cover that must be peeled off before the Melapatch is applied. This cover keeps the adhesive on the stretch fabric and the antibodies on the gauze untouched until the patch is ready for use. Overall, the innovation of the Melapatch would only serve to aid the proper identification of malignant melanoma. Implementation of the Melapatches into the healthcare field will make diagnosis easier for dermatologists and oncologists evaluating and treating melanoma. Having the patches readily available in local pharmacies will allow for consumers to confirm their condition and know when to visit the doctor. This innovation will create more specialized interaction between patient and physician, lessen worry for potential consumers, and reduce the number of unnecessary and expensive doctor visits.
With Melapatch, we can prevent another story like Nicole's or the thousands of others that suffer from melanoma each year. Thank you.